Hello and welcome to this edition of the Wise Medical Minute. I wanted to reassure a large number of people who consult with us that yes, you can be spared a tummy tuck. Now, before this video is over, I'm going to provide some examples of people who went elsewhere and were told that they had to have a tummy tuck, that liposuction wasn't going to be enough for them. Basically, historically, once upon a time, it was either liposuction or a tummy tuck. Nowadays, almost everybody who gets a tummy tuck has a large amount of time during their procedure spent performing liposuction. Now, furthermore, the people who do tummy tucks like to cut skin. The people who don't want a huge scar have reached a point nowadays where the new technologies will allow you to be spared the downtime and be spared the scarring that comes from an abdominoplasty. Now, we have access for 11 years to lasers that are notoriously helpful for reducing skin laxity and helping to remove more fat. The technologies have evolved, however, and there's both non-invasive and minimally invasive technologies that even do better job with skin tightening than the laser. Now, I'll mention the concepts of radiofrequency with and without microneedling. I'll mention the concept of a plasma device. There's more than one, but the J plasma is the most popular version of a helium-induced plasma way to heat the connective tissue under the skin, and it results in visible contraction even as you perform the procedure. But over weeks, the skin literally shrinks. And the surface area for a typical laser procedure reduces about 20-30%. Surface area for a plasma device is even greater and more dramatic and more immediate. So with the newer technologies that not only can reduce fat non-invasively, but can also develop muscle non-invasively, combined with physically removing fat, a large number of people, I would say as much as 80% of people who once upon a time were told they had to have a tummy tuck, we can spare you the downtime and the scarring. Now, I don't want to overburden you with details here, but in response to specific questions, I'll address the options available, and I want to spend most of the rest of this recording with examples of people who were told elsewhere that they had to have a tummy tuck, but they came to us and we spared them. Thank you for your attention, and I welcome the opportunity to respond to your specific questions if you email me at info@wisemedicalcenter.com. Thank you.
Thank you for listening to the Wise Medical Minute with Dr. Thomas Locke. Dr. Locke addresses current events as well as important medical issues using responsible, unbiased journalism approached from a medical perspective. We invite you to submit questions or comments or suggestions for future topics by email to info@wisemedicalcenter.com. Again, thank you for viewing the Wise Medical Minute.